Appropriate interventions and treatment for a patient with any sort of illness is obviously vital, but other things can impact on their well-being as well. For example, housing, ability to go to work, transport, all these things are the remit of policymakers, and engaging with policymakers helps to make a difference. For example, a patient who has schizophrenia may find it very difficult to find a job or to sustain that job in the way that somebody who doesn't have the illness can. And they may need incentives to help put them into the workplace. Government and employers can both be involved in helping in that process. Oxford Health Policy Forum produces scientifically very robust reports in different therapy areas. We work with a group of experts in the field, so the report has huge credibility, and we use a diversity of expertise within that group. So we might have a representative from a nursing group, a patient group possibly, as well as obviously doctors, clinicians, researchers. And we give writing support to that group in the preparation of the report. Once the report is published, we may use it as the basis for other activities. For example, we could take summaries for other audiences, smaller reports for example, policymakers, healthcare professionals, or maybe patient groups. And we also have experience of working in scientific meetings, for example, workshops or scientific symposia. So that's a clinical audience that you're reaching out to there. All sorts of ways that we can engage with audiences who need to understand the recommendations. Policy is an area that can make a huge difference, and anybody can be involved in an area that they choose to support. And don't ever think you can't make a difference, because you can.